Hi, my name is Sarah Schmiller, and this is my dissection of a mollusk. And the species I am using today is a mercenaria. So just some outer morphology here. If you look here, this lower part of the shell is called the ventral side. The upper is the dorsal. This side is the anterior, and then the opposite side is the posterior. Now this part up here is the umbo, and it is structurally the oldest part of the shell because it forms first. And then in between the two ventricles is that ligament right there, which is called the hinge ligament, which holds it together. Now on the inside of the shell, underneath the hinge ligament, are teeth that lock together to ensure no lateral movement occurs when the clam is closed. Now if you look here, these lines are age lines, which show sort of how old the clam is and how long it has been growing. Now, because we are using fresh specimens, I cannot open it due to a lack of a wood block, so I have already pre-opened one using a hammer, and now I will cut the anterior adductor muscle and the posterior adductor muscle. So I'm just inserting my scalpel, cutting very gently to release the muscles that hold the shell together. Remove that little fragment, and now onto the posterior. And being very careful not to ruin any of the inner structures. There we go. Alright, and now I'm just going to crack open the hinge ligament. And just peel off that upper shell. Alright, so if you look on the inside, here you have the anterior adductor muscle. On the opposite side you have the posterior adductor muscle. And then this fleshy bit right here is the mantle. Now there's an upper and a lower mantle, and they're sort of used to protect the inner organs of the clam. It's very thin and very delicate. Alright, I'm just going to go ahead and remove those. Now here, if I peel back that upper mantle, on the posterior side here, you have the incurrent and the excurrent siphon, which the incurrent siphon draws air in for the organism, and then the excurrent siphon is right beside the anus, and it expels waste materials. So the incurrent siphon is more ventral, and then the excurrent siphon is more dorsal. All right. And now I'm moving on to the labial palps, which are on the anterior side, which are right beside the mouth, and they're just those little fleshy bits there. And they're beside the mouth, and they are used to move food more towards the mouth. So just there. All right. And then the gills of the organism are underneath this upper mantle. Just going to go ahead and peel that back. And so these filaments here are the gills, which are used in gas exchange for the organism. Just that there. And then in behind it is the pericardial cavity, which holds a anterior aorta, a posterior aorta, and a single ventricle. So those are the gills. And the pericardial is extremely dorsal on this organism. All right, and then beneath the gills is the visceral mass, which holds the majority of the internal organs for this organism. So I'm going to peel back the gills and the labial palps, and then just open up that visceral mass, which is that structure there. I'm just going to cut that open so we can see the inner structures of that. Alright, and then inside the visceral mass is the reproductive material, or the gonads, which is this material here, which is interlaced with the intestines of the organism, which lead to this part here, which inlaid with it is a small pale structure, which is the stomach, and the darker surrounding material is the digestive ceca, which secretes the digestive enzymes. And then just dorsal or ventral of the visceral mass is the foot of the clam, which is used in locomotion and for when it needs to burrow deeper into the ground. Thank you.